All right, guys, welcome into chapter 14 bone, joint, and muscle injuries. As we get started, this is kind of my bread and butter as an athletic trainer. Musculoskeletal injuries are what we primarily take care of, although we can do a lot more than that. But so this chapter is a big one for me. So, first, we're going to talk about bone injuries. Bone injuries are most often associated with a very forceful cause of injury. It usually takes a lot to break a bone. Um, that can vary, but depending on the person, some people have bones that are more fragile than others. It depends on a lot of things. Sometimes they'll be present with like a very obvious deformity or disfigurement, like it'll be very obvious that the bone is broken, and sometimes it won't. The biggest problem with fractures, initially, at least in the emergency care, is any sort of vital organs or structures that are near them that can also undergo damage. From there, if fractures are not taken care of correctly, can lead to loss of function and things like that, and may require surgical intervention to regain those things. So, fracture and broken bone is the same thing. Okay, it always makes me laugh as an athletic trainer. Somebody will come up and say, "Oh, it's not broken; it's just fractured." Like, guys, it's literally the exact same thing. Okay, there are different types of fractures. That some are more serious than others, but in general, a fracture and a broken bone is the same thing. Okay, you do have two types or two categories of fractures, the exact same as we talked about with wounds and those types of things. Open fractures are a fracture in which the bone has broken the skin, and a closed fracture is where the fracture has not broken the skin, so the bones are still underneath the skin. So, this is a quiz question. Make sure you understand these next two slides. Okay, types of fractures. There are different kinds that can be more serious than others. So, the first type is a green stick. Think of it like if you were to grab a fresh green stick off of a tree and try and break it, it doesn't break clean like an old dead stick will. It just bends and cracks, right? So that's what a green stick fracture is. Happens most often in children and in individuals whose bones have not fully formed yet. Okay, not fully hardened. Transverse fractures is a cut straight across the bone at a right angle, like this. An oblique fracture is an angled fracture in a slanting direction, as it says here. Next, we have a comminuted fracture. That's a shattering fracture. So if it's fragmented into more than two pieces. An impacted fracture is when there's pressure on the ends of the bone that compacts the fracture and causes it to shatter like this. And then, of course, we have a spiral fracture. I kind of had to rig this together. The spiral is not, it wasn't part of this image here. But a spiral fracture is when there's a twisting. And so the fracture kind of comes around like this, and then on the other side, it would come down around the other way in a spiral direction. Okay, so make sure you understand those. There is a quiz question on those where you will label them. So as far as what to look for when assessing for fractures, we're going to use the acronym DOTS. Okay. Now, make sure you understand what this acronym means. We're going to come back to it a lot throughout the semester, and it is a question on the final. So make sure you understand. DOTS stands for deformity, open wounds, tenderness, and swelling. Okay. So when you're assessing an injury, the first thing we're going to look for is there a deformity. Okay. Obviously, in this picture, there is a deformity. Okay, so that makes it very obvious. Is there an open wound? In this case, there is no open wound. Okay, so say his arm was straight. There's no open wound there. So we'll move on to the next step. Where is the tenderness? Is it right on top of the bone? Is it more on top of the muscle? Those types of things. Okay, and then swelling. Where is the swelling at? I remember one time specifically covering a football game, and we had a kid get tackled, and he was in a lot of pain, and the right on top of his ankle. And it was interesting because the tackle was, there was nothing crazy, like it was just a normal tackle. The kid kind of got a hold of his ankle, but it wasn't really crazy. And when we started poking around, his tenderness was right on top of his fibula bone, so the bone on the outside of his leg, of his lower leg. And but that by itself isn't necessarily it's a red flag, but it's not a definite fracture. But right away it started to swell, and the swelling was right on top of his fibula, about the size of a golf ball. And so it was pretty obvious there. In my experience, the swelling will indicate what type of injury it is. So where the swelling is at matters. And his swelling was right on top of that fibula, and so it was pretty obvious that it was a fracture. And it turned out to be so when he got an x-ray. Okay, the other thing to look for, loss of function. Now, loss of function in and of itself is not discriminatory of a fracture. I broke my hand a couple years ago, and I could move it just fine. Of course, it hurt, but just because you can move it does not mean that it's not broken. Okay. Some other things to look for: muscle guarding. We talked about this last chapter. When the muscles around it really start to harden and tighten up to protect the area. And then crepitus, a grating sensation. So when they move it, they may feel, or if you touch it or move it, there may be sort of a grating. That is a sign of fracture as well. As far as what to do, the first thing you're going to do is check for life-threatening conditions. What is around the fracture? Are there major structures I need to be concerned about? Okay, check for bleeding, those sorts of things. Then we're going to try and expose the fracture to make sure that it's not an open fracture, that it hasn't broken the skin. So we're going to gently remove the clothing. Again, we're going to do our DOTS evaluation, look for deformity, look for open wounds, tenderness, swelling. And then we're going to check for CSM. So CSM stands for circulation, sensation, and movement. Okay. Now that is really important because even though it's not like it may not have affected a major organ, anytime circulation is compromised, anytime they lose sensation or they're unable to move the extremity or the area that is broken, where the fracture is, that could be sign of serious side effects. So anytime blood flow is cut off for a period of time, that can lead to tissue death. Anytime sensation is lost, or they're having some very severe neurological symptoms like tingling, the numbness, pain is shooting one direction or another, up or down the extremity. Nerves don't like to be messed with, and so it doesn't take much to cause nerve damage if a nerve is compromised for a period of time. So anytime there's any sort of neurological symptoms, especially sensation, we need to get them seen right away to get that taken care of. And then anytime movement is compromised, they're going to need to be seen by a physician. I mean, fractures in general is a referral anyway, but those three instances are very, very important. Okay, so make sure you understand those. All right, so as far as what to do, continuing on, let the person stabilize the injured part in a position that's comfortable for them, and then we can splint it from there. We're going to talk about splinting in a couple of chapters, some examples of how we can do that. If it's an open fracture and there's bones sticking out, don't push them back in. That can just cause more damage. If there is any exposed bone, just cover them with a sterile dressing, try and keep it clean and prevent infection. And then, of course, seek medical care. So, moving on from fractures, now we're going to talk about joint injuries. The first type of joint injury we're going to talk about is dislocations. Okay, a dislocation happens anytime a joint becomes displaced, right? Because a joint is where two or more bones come together. It's when the end of one of the bones is not where it's supposed to be. Okay. Obviously, this is not a normal looking elbow. Okay, that would be a dislocation. In this situation, this is likely it's probably a humerus that has come out to the side. Anyway, I have to look at it a little bit closer, but it can sometimes be hard to tell from just a picture. So as far as what to look for, most dislocations are going to come with a deformity. You're going to feel that something is not where it's supposed to be. Okay, obviously it's going to be very tender and it's going to be very, very painful. If a dislocation is not reduced or put back in place fairly quickly, it can start to swell and can make putting it back in place very difficult. They're not going to be able to move the injured part at all, because if the joint is compromised, the joint is what allows for movement, and so they're not going to be able to move it. Can also lead to numbness or impaired circulation, and that's when a dislocation becomes an emergency, even if it does go back into place. Anytime circulation, sensation, movement, that acronym again, CSM, anytime that is compromised, then it becomes an emergency. Okay. Most dislocations, if they go back into place on their own, are not an emergency. They should be seen by a medical provider, but it doesn't necessarily constitute an emergency room visit. Okay. All right, so you're going to call 911 if the extremity looks blue or extremely pale, or if transport of the person would be difficult, okay, or it might cause more pain or the injury. So CSM is compromised, okay, that is an emergency every single time. Okay, either EMS or quick transport. It's hard to write with a mouse like this. Getting used to it. Hopefully you can somewhat read that. Okay. So an example of when the transport might get difficult. So for example, a hip dislocation. It's very hard to transport somebody with a hip dislocation without causing a lot of pain, right? Like you got to sit on your butt. That's where the dislocation's at. So that would be very difficult. One time we had a football player that dislocated his shoulder and that we were unable to get it back in. He had what's called an inferior dislocation, which means the humerus went down and got stuck instead of coming forward or backward, which is the most common. But for him, he could walk around with his arm, even though it was out of place. He could walk around without a ton of pain. He just kind of stabilized it himself. So we actually just sent him in his parents' truck, right? They just drove him to the hospital, and that was fine. Not obviously the most ideal situation would have been to get it back in place, but in that situation, waiting for an ambulance to get there and transport him, like, it wasn't going to make any difference. He was tough anyway. You know, obviously when you're driving, if you hit a bump here and there, it might be a little painful. Can make putting a seatbelt on difficult, but he was a tough kid and he could handle it. Okay, so that's a determination you'd have to make in that situation. Okay, if EMS is going to arrive soon, hold the injured part and stabilize it until they arrive. If they're going to take a long time, or you have to go to distant medical care, then we're going to use the procedure called RICE. Okay, which here in a little bit we're going to break down what RICE stands for. Or did we talk about that already? I don't remember. Anyway, RICE stands for rest, ice, compression, and elevation. Okay, so rest meaning they're not going to use the part. You're not going to have them try and move their arm and that kind of stuff. Ice to help slow down blood flow and slow down swelling, prevent some swelling. Compression can help prevent the swelling from settling, and or can help with stabilization, right, with some splinting. And elevation, we want to try and keep the part elevated if it's plausible. Dislocation, that's not always plausible. It may cause more pain. But if we can elevate the body part, it can help, gravity can help prevent the blood from settling. You guys, as first aid providers, are not allowed to reduce a dislocation. I, as an athletic trainer, have been given authorization to do that, and I have the training to do that. You guys do not. So do not try to reduce a dislocation. If it goes in on its own, you're fine. That happens from time to time. But don't try and push and pull on stuff to try to get it back into place. So, if you have a dislocation with a wound, try and apply pressure on the wound to control the bleeding. Cover, again, any exposed bone with a sterile dressing. Most of the time, if you have a dislocation with an open wound, it's gonna be there's gonna be a fracture involved. Also, that does happen. A couple years ago, if any of you remember, Gordon Hayward, when he started playing for the Celtics, he broke his leg, like his ankle. What it actually was an ankle dislocation with a fracture in the lower leg bones. So I don't remember if it was the tibia or the fibula, or both. But he did have a dislocation there as well. So it does happen. Again, we're going to treat it just like we would an open fracture. Okay. All right. So now getting to some less severe joint injuries. First, we're going to talk about sprains. So sprains happen with ligaments. Okay. So ligaments are in charge of connecting bone to bone. So every single joint in your body has ligaments. Ligaments are not made to stretch. Ligaments are supposed to stay tight. They don't move. There's no elasticity to them. But they can be stretched if they are pushed beyond their normal range of motion. Can lead to tearing of those ligaments, either partially or completely. But it just depends on the situation. Okay, so ankle sprains are probably the most common type of sprain that we see, especially the outside here. So this is somebody's ankle, right? These ligaments that are out here on the outside of the ankle are very commonly sprained. Just a little side note here. Anytime somebody sprains the inside of their ankle, it's a lot more serious because that doesn't happen very often. The ankle doesn't move that direction very well. But that's what a sprain is anytime there's damage to those ligaments within the joint. So, you may see some similar signs and symptoms as a fracture. There'll be a lot of pain, swelling, bruising, and or discoloration. But the treatment is basically the same, meaning we're going to use RICE, rest, ice, compression, elevation. Make sure you understand this acronym. It is a quiz question. I knew there was a slide on it. I just, for some reason, when I glanced through, I couldn't see it. Anyway, so make sure you understand what this stands for because it's a quiz question. So again, rest, don't use, well, so depending on the injury, when it says rest, it needs to be appropriate rest. So I'm even going to write that. Appropriate rest. Just because you sprain an ankle doesn't mean you can't walk on it. Okay? As long as it's not super painful, it is okay to walk on an ankle sprain. And even those minor ankle sprains, like I as an athletic trainer, if it's in the middle of a game or a practice or something, most of the time, continuing to practice and continuing to run on it and those things, as long as it's stable enough, that's usually the best thing for it because the muscle movement helps prevent some of the swelling from settling, keeps it moving, keeps it from getting too stiff, and can prevent some of that excessive muscle guarding in the area. So, appropriate rest is important. If they can walk without a whole lot of pain, like that's appropriate. If they can use the joint without a whole lot of pain, that's okay. Okay. If it causes a lot of severe pain, then no, don't move it. Sharp pain equals damage. Okay, so that's really important to keep in mind with these soft tissue injuries. Okay, sharp pain equals damage. And I say that a lot to our athletes. Any of you athletes that are in this class probably have heard it before. We want to avoid any sort of situation that leads to sharp pain. Okay, achy pain, dull pain, that's different. Okay, those are different things. Those can be normal, but sharp pain is a no-go. Okay, so using an ice pack, usually we'll do 20 minutes at a time. So apply it for 20 minutes and then take at least a 20-minute break to help slow down the blood flow and avoid excessive fluid settling in the area, swelling. Okay, compression, apply it for 3 to 4 hours. So you'll ice, then you'll compress it for a while, and then you'll go back to ice. Usually, I tell the athletes, anytime you are not icing the area, you need to have compression applied, even when you're sleeping, at least for the first 72 hours, first 3 days. And then elevate, if it's applicable, if you can do it without pain, try and elevate the area to prevent the fluid in the blood from settling and creating some excessive swelling. Yeah, that's rice. Make sure you understand it. Okay, so the last thing we're going to talk about are muscular injuries. Okay, and you're going to hear a lot of the same stuff that we talked about with sprains and fractures and dislocations, but now we're talking specifically about muscles. Okay, so the first one is strains. So strains, don't get these confused. It's really easy to do because they sound similar. Strains, because of the T, okay, strains refer to tendons. Okay, tendons connect muscle to bone. Okay, tendons are what allow for movement. Okay, so strains are muscles or tendons. Okay, which are sort of the same thing. They're connected. Okay, whereas sprains, which we already talked about, okay, are ligaments. I need to get like a pen that I can draw this. Anyway. Ligaments. Hopefully you can read that. Okay. So strains happen anytime that a muscle is stretched beyond its normal range of motion or it's pushed beyond its capacity. Okay, if it's not able to handle a certain amount of force and you push it beyond that, it can cause a strain. Okay, inflammation usually begins pretty quickly. Sometimes it can take up to 24 hours for the pain and the stiffness to start, but most of the time it comes on fairly quickly. So things to look for, usually it's going to occur during physical activity. It's not just going to be sitting there. There's going to be sharp pain. It's going to be really tender. They may not be able to use the injured muscle very well, or they'll have decreased strength. But just because they can move it doesn't mean there's not a strain present. Okay. They may have stiffness or pain when it's used. Yeah, those are just a few things to look for. Okay. As far as how to take care of them, guess what? We're going to use rice, just like we do with sprains. Okay, rest, ice, compression, elevation. Now talking about cramps. If you haven't had a cramp before, good for you. They suck. Okay, a cramp happens when a muscle goes into an uncontrolled spasm and contracts. There's a couple different kinds of cramps. So there's like sports-induced cramps or heat cramps, exertional heat cramps like it says here, or then there's night cramps. Night cramps are usually associated with diseases, diabetes, atherosclerosis, which is narrowing of your arteries, or like can be due to severe, not severe, but like ongoing dehydration, things like that. Whereas exertional heat cramps are usually a result of physical activity, especially out in the heat. One thing that I have learned as of recent with a lot of the current research is there's no like one thing that a heat cramp can be caused by. It can be caused by a lot of different things. And I'll talk about that here in just a minute. So when a cramp occurs, there will be a sudden severe muscle pain The muscle, it happens most often in the calves, but it can happen in the hamstring, it can happen in any muscle in the body, okay? But it'll feel very hard and rigid because it is in an active contraction, but it's not voluntary. The person is not actively contracting the muscle, it just contracts by itself, and it's very painful, okay? You can have some residual discomfort, meaning that it hurts for a couple of hours after. That's normal, okay? As far as how to take care of them. So gently stretch the muscle, try and get it to relax. You can also use some soft tissue mobilization or like massage to push on it. You can use a massage gun, apply some pressure to the muscle to help get it to relax, okay? Afterwards, apply an ice pack, try to calm down any of the inflammation. The biggest thing, try and get the person to stretch frequently throughout whatever activity they're doing. So if the activity is not over, tell them to continue to stretch throughout the activity. Really, any chance they get, any breaks they take, plays off, things like that. If the activity is over, then they need to stretch several times throughout the day. Okay. As far as how to treat them and prevent them, again, like I mentioned before, the biggest thing that I've learned throughout some of the most current research is that cramps, especially heat cramps and those that are a result of physical activity, exertional heat cramps, they're not linked to any one thing. Historically, some of the research or the attitude has always been, well, just drink tons of water. You're dehydrated. Drink water, drink water, drink water. Drink pickle juice, get in some electrolytes. And those can be helpful, but not every heat cramp. Research has shown that not every heat cramp is caused by dehydration or electrolyte loss. Okay, every person is different. They've learned that it's more of an individualized approach to prevent these. For some people, it's dehydration. For some people, they're low on electrolytes. Some people, it's just because most often it will happen at the beginning of the season when they're just getting back into physical activity after being inactive for a while or less active. Sometimes it's just because they're just getting going, right? Maybe they need to warm up a little bit better. Maybe they just need to get in better shape, okay? But trying to get to the root of what the problem is and try and figure out what this person's deficit is, maybe they're not hydrated enough. Maybe they don't get enough electrolytes in their diet. Maybe they don't ever stretch and they just need to stretch more. Okay, maybe that muscle was tight to begin with, and so it just had a reaction with the physical exertion. So try and get to the root of the cause rather than just saying, oh, just drink water, or oh, you just need to drink a Gatorade. Okay? All right, so muscle contusions. A contusion is the same thing as a bruise. Okay? These two words are synonymous. Contusion, bruise, same thing, okay? Happens from a direct blow to a muscle or a piece of soft tissue, okay? Some things to look for contusions. The person will report that they got hit with something, they ran into something like that. Can come with some swelling. They'll be tender and painful, and you can get some discoloration like black or blue. Eventually, it will go more of a yellow to a greenish color, okay? As far as treating contusions, you're just going to treat it with rest, ice, compression, elevation. But for some of those large contusions, you need to go see a medical provider. Biggest reason is all a contusion or a bruise is internal bleeding. Okay, there's been a blow to the tissue and it started to bleed. So when blood settles, if it's not evacuated, if the blood isn't reabsorbed, it can create what's called a hematoma. A hematoma is coagulated blood in the body that hardens. And if that isn't evacuated, if that's not broken up and evacuated by the body or reabsorbed, then it can turn into what's called myositis ossificans, which means that the blood hardens and calcifies, and it can actually cause lots of damage in the musculature. And it's very, very painful, and it's not good. So, especially with large bruises, you don't want to let them harden. Okay, sometimes you have to do some massage. Sometimes you have to do like ice. You have to roll it out, something like that, to help get the blood out of the area and get it reabsorbed. So early on with some of these larger contusions, using rice is really important to prevent some of that excess blood from settling in the area and letting it become a hematoma. Okay, so that's all we have for chapter 14. If you have any questions, please reach out. We'll see you later.